Hello and welcome to my channel, Boo Snakes and More. Today we're going to be talking about Phillip Pennell, MD, 1939 to 2007. So please like this video and subscribe to my channel. And for more videos like this, also watch my other house channel, A&A Snakes and Stuff. My youngest son's channel, Henny's Toys and Games, or my oldest son's channel, Little Chris 10. Now let's dive into the video. Founder, U.M. Miller School of Medicine, Health, and Human Values Program. Phillip Pennell, 68, professor of clinical medicine and medical director at the University of Miami Dialysis Unit, died September 27, 2007, at home in Coconut Grove. Dr. Pennell, while caring for dialysis patients, was a medical educator and researcher. He enjoyed teaching and focused on bioethics. He was a leader in introducing ethics into medical school curricula in Florida. He founded and directed UM's former Health and Human Values program. He taught students and residents in psychiatry, psychologically, and other disciplines, emphasizing critical thinking skills and a compassionate approach to patient care. In addition to his primary appointment in the Department of Medicine, Dr. Pennell held a joint appointment in the Department of Psychiatry and Behavior Sciences. He established ethics rounds for UM's third-year medical students, where they presented and discussed cases that raised interesting and often difficult ethical challenges. Phillip held medical students to the same standards he set for himself, said Judith Vandercliff, American College of Medical Genetics Foundation, and a former colleague of Dr. Pennell's. He was demanding, but no one cared more about students and the kinds of doctors they would become than he did. He took as much pride in their successes as he did in his own. I remember the twinkle in his eye and the way his smile turned up when he taught what he really loved, in the dry sense of humor that left the students puzzled. He chaired the ethics committee for the Health Council of South Florida for nearly a decade. His commitment to medical education was shaped by Carleton College, the University of Rochester medical student, a residency in neuropathy at the University of Petersburg during the early days of dialysis, followed by a fellowship at Barnes Hospital in St. Louis. He served as a lieutenant commander at the Naval Hospital in New Orleans during the Vietnam War until joining the neuropathy division at Stanford University. He helped to design the new dialysis unit there, emphasizing home dialysis, teaching families to help care for and dialyze their own family members at home. Dr. Pennell was an avid sports fan and athlete, and he started playing basketball at the age of 4 with a hoop on the back of the kitchen door. He took his hometown high school team, the Cucamonga Wildcats, to the state championship. He also played varsity ball at Carleton, where he met Mary, his wife-to-be. They were married 45 years. Dr. Pennell relished a lively conversation over good food and wine. He enjoyed a house full of family and friends, a kind of saloon. He was diagnosed with gastroblastoma and died at home surrounded by his family. He is survived by his wife, daughters Paula Pennell of Wichita, Kansas, and Pamela Pennell Kelly, grandchildren Evelyn and Adidas Kelly of Coconut Grove, and his sister Sally Heaton of Klamath Falls, Oregon. He requested his body be given to science. No memorial service was held. Thank you for watching this video, and peace out till the next one.